important point about getting people out of the clinical environment to basically, just to experience life. And I certainly brain cancer and the more difficult brain cancer, glioblastoma, it's a very difficult diagnosis. And while there are new treatments, there's certainly progress. It still is daunting, if not devastating, to people. How important is it to sort of understand the need to continue to live your life and to experience things that are normal, which is what Headford attempts to do. Can you talk a little bit about the sort of the emotional side of that, the psychological side of that?
Oh, absolutely. Our patients, first and foremost, really want to be seen as people. You want to have that sense of normalcy with your life. I think that's one of the very unfortunate things that such a devastating disease can sort of rip away from people is their sense that, the rest of their life outside of the disease is, still the same. They're not, their life does not revolve around this disease. Rather, the disease is just one facet of their, current life experience. And, part of that is really, making bonds, meeting, friends, people who share, commonalities both within, the sphere of, brain tumors or, clearly outside of the sphere of brain tumors, which is always something that these community events really, do a great job of doing. We want to know the commonalities between our patients and, their spouses and what they do, rather than, the only subject being this insurmountable diagnosis.